Infertility impacts 1 in 6 people, according to the World Health Organization. For Infertility Awareness Week, we're talking about what can cause infertility and when a person should talk to their doctor about issues conceiving. With me today is Dr. Rebecca Lobell, an OBGYN at St. Luke's Women's Health East. Thank you so much for joining us.
Thanks for having me.
So first of all, what's the simple medical definition of infertility?
So easiest thing to remember is more than 12 months of unprotected intercourse without achieving pregnancy.
Okay. Now, as an OBGYN, when do you first bring up this conversation with your patients about when their plans are to conceive?
So I really like to use their yearly exam as an opportunity to just ask a simple question. Do you plan to have kids in the next year? It's easy for them to answer without, thinking too much about it, and gives me an idea of, any instructions that I should give them about when to come back and see me if they aren't able to achieve pregnancy.
Okay, and when is a good time for a patient to come back and have that conversation with you if they are having any issues?
So it's really age dependent. Unfortunately, age is a huge factor for fertility in women. So I kind of divide it into less than 35, 35 to 40, and over 40. So for women under 35, that 12 months. If you can't conceive after 12 months, come back and see me. Over 35, 6 months is the general recommendation. And then if you're over 40, just because of that age and how, timing is of the essence, I offer them immediate evaluation and treatment. There is a caveat to this. So if you have any condition that might impact or put you at high risk for infertility, you should really come in and see your doctor right away.
Okay, good to know. Now, if a patient continues having difficulties, what are the next steps or tests that are offered?
Yeah, absolutely. So I would have you come in for a infertility evaluation, and what that kind of consists of is a detailed history of you for both partners, for male and female, physical exam, as well as typically ordering labs and imaging, as well as a semen analysis to kind of work through those different potential causes for infertility. I usually will also touch on those causes, as well as potential treatment options and potential referrals to a specialist, depending on what we find.
Okay, so let's talk more about those causes. What are some of the main factors?
Yeah, absolutely. So when I talk to my patients about it, I think the easiest way to break it down is into male and female factor. Males, it's easy. Get your semen analysis and let's make sure that that's working. There are a lot of different causes for why men may have an abnormal semen analysis, but that's a good place to start. Most of your OBGYNs are going to be able to order a semen analysis for the male partner. For women, it's a little more cumbersome. So again, depending on your goals, we'll go ahead and talk about what the workup looks like. So for women, break it down into hormonal issues, ovarian issues, tubal issues, and uterine, okay? And so that's an easy way for me to break it down and then tell them how we test that. So for example, if we're gonna look at potential ovulatory or ovarian issues. So we're gonna look at ovulatory function. Are you ovulating each month? We're gonna look at ovarian reserve, and we can do that through lab tests. We'll also do imaging to look for, tubal factor or any uterine factors that may exist.
Okay, and when might a person need to see a reproductive specialist?
So again, that really depends on why you're having that conversation on, what is your ultimate goal and kind of what is your end point? How far are you willing to go? So depending on what the underlying cause is, for example, if it's unexplained infertility, those patients are going to benefit most from probably in vitro fertilization. That's what studies have shown. So if you need IVF, you're going to need to go to a reproductive specialist.
Okay. Now then, after testing, once a patient has either conceived on their own or through the help of a reproductive specialist, what does their pregnancy care look like?
So for the most part, it's going to be your standard prenatal care. There are certain, I try to focus usually because it's the underlying condition that may impact what their prenatal care looks like. So for example, women over 35 are going to have increased testing in the third trimester to help decrease their risk of stillbirth. Women who conceive with in vitro, again, a little higher risk of things like preeclampsia, growth restriction, stillbirth. Again, we're going to do that extra testing. But for the most part, it's going to be, your standard prenatal care. You're going to come in at 8 weeks, and we'll lay out kind of what those things look like and if there's anything different that you may need due to these underlying fertility issues.
Okay, great. Well, is there anything else you'd like to add?
I think the main thing that I really like to focus on, and I hit this in that infertility evaluation, is the psychological component of infertility. It's really hard on both men and women. There's a lot of feelings of, just sadness and frustration and anger. So I like to really reassure them, one, those feelings are normal, okay? Typically when they come and see me, they want to be pregnant yesterday. And so I let them know that those feelings are normal. Don't isolate yourself. Talk to your friends, talk to your family, just like you would when you got pregnant. Tell them that you're struggling. So having someone to talk to, but encourage them that you've now found me, you're in the right place. And most women that want to achieve pregnancy, they will.
Yeah, well, that's great news. Thank you so much for joining us and for sharing all this great information.
Absolutely, my pleasure.
To learn more about St. Luke's maternity and obstetrics, visit stlukeskc.org/maternity. You can also find updates on other health news at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.